Hey everybody, Dan here with Pain Free You. Today's topic is going to be, once you know it's TMS, ... and I'll finish that sentence in a minute. But first we're going to breathe a little bit. Breathe in the clarity. Exhale the doubt. Breathe in the certainty. Exhale the uncertainty. Breathe in the accurate knowledge and exhale the misinformation. So first of all, I have to admit, this is take 2 of this video. Recorded a good take of it, got to the computer, went to listen to it, and the audio wasn't there. Somehow the plug on the microphone came undone and I had 0 audio. So we're going to try this again. So, once you know it's TMS, stop doing this. Stop referring to, hey Finn, stop referring to the medical labels that you've been given by your doctors. Doesn't matter what you were told about your symptoms and what the cause of them is. If you've got imaging studies that say, well, you've got this bulging disc, herniated this, spinal stenosis, that, spondylolisthesis, you name it, stenosis, it doesn't matter, torn rotator cuff, torn meniscus, bursitis, arthritis, degenerative disc disease, carpal tunnel syndrome, repetitive strain injury, orbital migraines, occipital migraines, pudendal neuralgia, trigeminal neuralgia. All of these are medical labels. Fibromyalgia, by the way, IBS, digestive system issues, even some immune system issues. They are very often medical labels that the doctors give you based on the symptoms and based on what's in the insurance code and the diagnostic tools. But that doesn't necessarily mean it's accurate. It very well could be that those are medical labels given, but there may not be proof that that's the cause of the symptoms. So what I really encourage is, and I follow Dr. Schubner's lead on this, let's rule out the life-threatening stuff, the catastrophic, the infections, the tumors, the fractures, things that truly require medical attention. Rule that stuff out. But then we rule in this thing called TMS, perceived danger pain, as I like to call it. And once we rule it in, we're able to take all the middle-of-the-road diagnoses and imaging studies and all that crap and set it aside and say, this does not apply to me. Yes, those things exist, but if your symptoms are behaving like TMS or this perceived danger pain, then it is not structural, because structural doesn't behave the same way as TMS does. And so it's really important to get clear on exactly what's causing your symptoms or your pains. So once you do that, I'm going to really encourage you to stop identifying yourself as, well, I have fibromyalgia, or I've got this, or I've got that, and using medical labels in describing what's going on. Further, I will absolutely tell you, stop using the word injury if there was no true injury, right? The acute onset of pain, bam, there it is not proof of an injury. If you got checked out and they can't find any tears or, broken bones or anything like that, then it wasn't an injury, right? I had an acute onset of lower back pain probably dozens and dozens of times over a 13-year span. None of those were injuries. They were just an acute onset of TMS and this mind-body stuff. It certainly feels like an injury. And that's why there's terms like, oh, my back went out. I threw my back out. Dr. Sarna used to laugh about that and say, that's not even possible. The back is so well protected, by the tendons, the ligaments, the discs, the muscles surrounding it, the bones themselves, the spinal cord itself. It doesn't just throw out. I mean, it takes a significant trauma, physical trauma, car accident, fall, something really, really dramatic to whack things out. but it takes a really significant one. You know, falling off a lawn chair is not a significant trauma. So, really, I want to encourage you to rule in TMS. And hopefully you've already checked out and made sure that there's nothing significant going on. Infections, fractures, tumors, anything life-threatening. Use your discretion. If something feels really significant, get to the doctor. If it's really significant, get to the emergency room. Right? Don't take chances and call everything TMS. That's not what I'm telling you to do. I'm telling you to rule out the really bad stuff and then rule in TMS. And once you've ruled in TMS, it doesn't matter what the imaging study says. If your symptoms are behaving like TMS, then it is. If you want some help in figuring out if you've got TMS or this perceived danger pain, go to the pain test, yourpaintest.com. Yourpaintest.com. Any score over 29 means you can get rid of the pain because it's behaving like TMS, not a structural abnormality. The other thing I'll point you to is ppdassociation.org. Write that down, ppdassociation.org/symptoms. What you'll find there is a list of dozens and dozens and dozens of symptoms of TMS, of this perceived danger pain. And you'll see there's a wide variety of stuff. And it's a much bigger list than you might think. Because there's a lot of us folks out there that go, well, I'm different. I don't have back pain. And Dr. Sarna didn't write about back pain, so this doesn't apply to me. Yes, it does. Go look at that list, ppdassociation.org/symptoms. So that's an indicator. But further on that same page are 30 questions, which will ask you about things like your personality types, your childhood a little bit, how does your pain behave, does this work, does that do this? Answer those 30 questions. Write down the answers and count how many you have said yes to. The more that you say yes to, the more certain you can be that it's TMS, perceived danger pain. And so rule out the life-threatening, rule in TMS, forget all the crap in the middle that you've read about, heard about, been told by doctors, seen on your imaging studies. If it's behaving like TMS, then it's TMS. You've heard that phrase. If it looks and smells like a duck, it's a duck, right? If your TMS behaves like TMS, it's TMS. Please don't argue against that, because here's the reason for clarity. Step one of this entire journey needs to be getting clarity on the cause of your symptoms, because as long as you're doubting it, doesn't matter how much you do journaling, meditation, breathing exercises, somatic tracking, pain reprocessing therapy. I call it the 6 steps to resuming activity. Indifference. Doesn't matter how indifferent you are. If your brain is convinced that you got a body problem, do you really think that the brain's going to turn that off? It won't. I don't believe it will at all. Uncertainty and doubt creates danger, because in my case, I had lower back pain for over a decade, and any time I'd bend over, I was afraid that I was going to hurt myself, right? So as long as I felt like it was a body problem, when I would bend over, what do you think my brain would do? It would turn on pain. Ouch! Every time. Why? Because it was trying to warn me from bending over, because in the past, I have, quote-unquote, hurt myself so many times by bending over, that became dangerous to me. So the brain was just using pain as a warning signal. And here's the point. If you think your body's a problem, don't be surprised when your brain is warning you against use. Right? To me, this is simple to understand, a little more challenging to implement, but these concepts are fairly simple. If the brain perceives danger, it's going to warn you with pain against doing certain things. And it could be as simple as getting up to go to the bathroom or rolling over in bed. It doesn't have to be this extreme activity for the brain to perceive danger. So, as much as possible, let's stop using the word injury, because unless you really had physical blunt trauma to the body, you likely didn't get injured. You had an acute onset of TMS, or mind-body pain, or this perceived danger pain, that certainly feels a lot like an injury, but it's truly not an injury, right? other thing is some people will exercise and they'll feel the pain later, but not during the exercise. Then they'll say, oh, I must have injured myself exercising. No, you didn't. Because if you had, it would have hurt in that very moment when you supposedly injured yourself, right? If it looks and smells like a duck, it's a duck. If it looks and smells like TMS, it's TMS. Get really clear on that. Make a decision to accept that that's the case, because the sooner you accept TMS, this perceived danger pain, as the cause and the only reason that you've got your pain, the faster your brain is going to go from up here, scared, firing off those warning signals called pain all the time, to settling down and letting the pain fade away, right? The sooner you make that decision, the sooner you commit to maintaining that decision, even in the face of a little bit of doubt or in the face of some symptoms or colorful days, even in the face of all that, stay firm, stay committed, stay convicted that this is exactly what is going on with me. Because the more you can reinforce that, the more the brain's going to learn to trust it. If you say for 3 days, yeah, I'm good, it's just TMS, but then on the fourth day you have a little bit of a flare-up of pain, and you go, oh my God, it must not be TMS, it just went up. That's not evidence of it not being TMS. More pain just means the brain is perceiving more danger. Well, what were you doing that the brain may have perceived as dangerous? Maybe you were feeling a little bit better and you took an extreme exercise class because you were feeling good and you made it, but the next day, man, you paid for it. You didn't hurt yourself, you didn't injure yourself because you would have hurt in the class. Hurting the next day is basically your brain sensing a little bit of normal muscle fatigue from the exercise, and your hypersensitive brain and nervous system goes, oh my God, what's that? I must have overdone it. And then the fear, the obsession, and the focus on the symptoms come in, and all of a sudden you're really, really hurting. Things get really, really colorful. But it's not proof of an injury. Pain is not a reliable indicator of the condition of the body. It's not a reliable indicator of injury. However, it is an extremely reliable indicator of the brain's perception of danger. So if you have pain kind of come out of nowhere, well, what do you think the brain might be perceiving as dangerous? If you just did a big workout yesterday, that could have been it. Normal muscle fatigue, that could be perceived as a danger that the brain goes, oh my God. So once you've determined it's TMS or mind-body pain, we're going to let you look at Finney. Once you've determined that, really, truly, let go of the medical labels, the diagnoses. That is not what is causing the pain. If you ruled in TMS, then it's TMS. Please don't waver, because that's just going to delay your recovery. Making a commitment will speed up your recovery. Stop using the word injury. Stop using your medical labels. And I know you can get better. I wouldn't be out here doing this every single day, running the group, running my private coaching, if I didn't think you guys and gals could get better. You can. But it all starts with step one. Determining that your symptoms are from TMS alone and nothing else. When people say, well, TMS might be involved, this mind-body stuff might be involved, I don't think that's the case. Now, there are cases where there was a legitimate surgery or a legitimate injury, and 6 months, 6 years later, you still hurt. Why is that? Learned pain. The brain has a memory that if you fear something and focus on it enough, even though the body has long ago healed from that true injury or surgery, with that fear and attention, the brain could learn and wire those pain signals. And with fear and attention, you get in that fear loop, which can cause the pain fear loop and keep things persistent long after the body's fully healed. So don't look at that as an opportunity to say, yeah, Dan, but I'm different. No, that also fits the same mold. Your brain's perceiving danger. Your brain's perceiving that you didn't heal, so it's keeping the warning signal called pain going. That's it. So I think that's all I got for you. I'll let you guys say hello to Finn. Hey, Finny. All right. Finn says hello. Oh, big yawn. All right, folks. Love you. We'll see you tomorrow.